Joining us in our newsroom is a familiar face, Dr. Christopher Doering from Franciscan Health. Hi, and thanks for being here.
Absolutely. Good to be with you, Mary.
All right, so we have a perspective paper that came out today or yesterday, and there's this sort of scientists were saying that it could be beneficial to have the Pfizer vaccine just in one dose as opposed to two. And so their argument was, of course, that this could vaccinate more people, right, in a shorter amount of time, but this isn't really evidence-based. So first I want to say, what are your thoughts about this argument about giving the Pfizer in just one dose? And maybe cost versus benefits without taking a look at, the science going as it is right now?
Yeah, it's a really good question, particularly here in the early days when the supply is fairly limited, having to make kind of a judgment about what do you have the most confidence in. And there's no doubt that one dose does provide some protection, but the way these two vaccines that we currently have available were designed and researched, and their approval from the FDA was based on 2 doses. So that's where there does become a little bit of a academic argument around what you see in some of the data versus what's really appropriate in terms of public policy.
Mm-hmm. And so we have to follow the science, of course. And one of the perspective, these people being a proponent of the one dose, they said that, or there could be an overestimation, someone who is against this, proposing this. So what does that look like? Is it the statistics, the math? I mean, how does that happen? How could there be an overestimation?
Yeah, so when they did the study, they looked at the protection from the day, basically, that the first dose of the vaccine was given. But when you looked at limited time periods, say a week after or 2 weeks after, obviously you're going to see more protection the further out you are from that vaccine having been given. So when you narrow down the number of people who you're looking at and the number of cases that are involved, you do start to see obviously growing evidence of protection. But again, the way the study was designed, the way the vaccine was designed, was to be given as a 2-dose series. And that second dose is really intended to confer longer term protection that endures more than just maybe a couple months. So while I think the commentary that you see in the New England Journal editorials that sort of raises this question, and actually at the public health level, I think the UK did make it their approach was 1 dose for everybody, and then we'll get around to the second dose. But here in the United States, the FDA made the decision, and the ACIP endorsed the 2-dose regimen being appropriate for Americans.
Right. So, Dr. Doering, the message here, what I'm hearing is it's important to follow the science in always.
Yeah, absolutely. And again, a 1-dose option is an exciting development. I think the J&J that's coming is going to be a real game changer for us. But at least here in the early months of vaccine availability, sticking with the structure that was studied, the EUA approval terms makes the most sense, and we believe is the most appropriate, safe, and effective way to proceed. So always trade-offs, but you're right. We got to follow the science in the way that it was executed here in the research trials.
Right. So, I mean, maybe at some point there will be a research study moving forward, but it's just not there yet. And we want to, of course, stick to the studies that we know are proven to be safe and effective. Well, any last thoughts for our audience? 30 seconds.
Yeah, I mean, a similar question has been raised around somebody who's already had COVID. Could you just give them 1 dose and that kind of boosts their immunity and they're good to go? A great idea, makes a lot of sense, but it just hasn't been studied and is not part of the approval at this point. So that's why we're kind of, stuck with this approach that we have, that, we're getting folks vaccinated in the right priority, protecting people. And I think we're seeing the benefits of that with the numbers that have been crashing down over the last several weeks. So.
Well, Dr. Doering, always great to see you, have you on. Really appreciate your time.